Good deal. All right, guys. What we always talk about is how do I get into these topics? And again, my opinion only. But what I'm finding is data collection, length of stay, what's the other word I would use? Observation versus admission. We've talked about all that. You guys have been to those lectures. That's a change. And how did it occur? From statistics. What does statistics tell us? Statistics tell us 500,000 people die from Alzheimer's a year. 500 million. 500,000, excuse me. 500,000 from Alzheimer's disease. Do we consider that life-threatening? Over 65, the number 5 cause of death, Alzheimer's disease. Overall population, number 6, cause of death. Okay, so everybody see how I arrived at this? This is something that you have to pay attention to understand what it is, how it works, what you need to do about it so that you can prevent it from taking your life. Does everybody understand me? Now, if anybody in this room is of the belief that once you lose your memory, you don't want to live, then that's a whole different story. I'm talking about in general, my job is to keep you alive. And my job is to do the best I can to keep you well, healthy, and hopefully happy. And I know a lot of happy Alzheimer's patients. Everybody with me? All right, some more background. Whoa. Does everybody know what hospice is? Hospice is usually part of a home care organization. Usually, I say. It could stand alone, and there are many that stand alone. I don't ever advertise, so I'm not advertising who I work with or for, but I've been a hospice provider for many years, okay? And what we do is we follow patients with Alzheimer's. And we break it down into 7 categories. And what do we do that for? To best manage the patient's needs. When it comes to Alzheimer's disease, your independence is challenged. And unfortunately, you, and I'm not pointing out one person, myself included, you don't think there's a problem when you have a problem. So what we're going to talk about in those 7 stages, it could be found out earlier and things can be done to help earlier, but the person that has the things we're going to talk about today doesn't talk about it and actually hides it. Why is that? I'm not a psychologist or psychiatrist, but it definitely has to do with how we think and how we were raised and what kind of things we value. Like I said earlier, if someone in this room has the theory in life that if they don't have a memory, they don't want to be here, then I'm not addressing you particularly today, but that's your choice. And so similarly, in terms of how we would manage the situation of knowing that things are different than they normally were. What does that mean? The very first things that occur with Alzheimer's disease are things like speaking and forgetting what you were talking about, or speaking and in your mind's eye you had the next word you were going to say, but it didn't come out. And again, I've done that and I don't have Alzheimer's. Is everybody with me? Like what happens now because of the internet, everybody can get on their phones and their computers and they can look up on WebMD and all these other things and they put it together as if it's a crossword puzzle. It's not a crossword puzzle. And what you have to understand is when the changes occur, they're subtle to me, not recognized to me, the PCP, but you know. And that's the whole purpose of today. It's the 5th among 65 and up and 6th globally cause of death. It is life-threatening if you allow it to be. How does that happen? All medicine, what's the number one thing? Number one, catch it early. Does everybody follow me? I know you have family members that have had devastating diseases. And I know you've had family members that have fought it and won and fought and lost. My mother had stage 4 colon cancer. That means she's got a 20% chance of living 6 months. She lived 24 years. Is everybody with me? Like, these are statistics and statistics only. Today's objective is, you know your memory has changed and you know how it has changed. Talk to your doctor, or at least your loved one. Tell somebody, because holding it in, that stress also causes complications. Everybody follow what I'm talking about? All right, so what did I learn in hospice? What I learned in hospice is we have to have a diagnosis in order to enroll the patients into the organization that's going to take care of them, okay? And what I noticed while I've been working there is the increase in younger ages of Alzheimer's. 45, 38, 46. Is everybody following me? What does that tell you? You know, I've been around 62 years. And just like you don't get anything free, when you see changes, something's causing it. What's causing it? Those are the things we're doing to try to find out for the younger generation. But for us, what we have to know is, you know when your memory changes. You know when things aren't the same. You know that things have changed for you in ways that maybe only you are detecting. Your spouse or other loved one, significant other, may not know. And you don't tell them. And again, why? Not today's topic. We'll talk about that at another time. But please understand what we're going to run through and what we're going to talk about. The objective of today is to make sure everybody recognizes it is life-threatening. And I usually don't give up that at the beginning. I guess I did it to make sure everybody stays awake. All right, so we're going to categorize. We're going to go 1, 2, 3, 4, 5, and then 6 and 7. The characteristics of these, what they put on them is different descriptions that everybody can understand. Moderate, severe. This would be severe. Okay, and in this category, there's change that occurs. Why was it discussed like this? History. 1992, I was the medical director at Arden Courts on Perry Highway, affiliated with North Hills Manor Care. I was also the medical director at Manor Care at that time. And what I can tell you is, the girl, the nurse that runs the Arden Courts, the Alzheimer's unit, has been there since 1994. Why am I bringing that up? The person you want to take care of a loved one that gets into this situation has to understand Alzheimer's disease. Is everybody with me? If you can't take somebody repeating the same thing 50 times in a minute, you're in the wrong profession. Does everybody follow what I'm telling you? I'm bringing this up because I started a support group in 1992 that's still going on today. And why I'm happy about that is, it's a disease that no one knows about. Who knows about it? The person that cared for the patient that had Alzheimer's. And that's how we started it. And it's still running today because it's a vital asset. So if you have a loved one that has the problem, you don't have to go to the one in the North Hills, but definitely get to a support group. Because what you're about to go through, or if you're in the middle of it, what you know you're going through, it's a difficult challenge for you because A, just as this person, as we're going to go through, may not recognize you the way they used to, you don't recognize them anymore either based upon what their function has become. Does everybody understand that concept? We needed that picture painted before we started. We're going to go back to these, how I divided up into 7 categories, because that's how we do it with the hospice. But what we want to talk about is, what is Alzheimer's disease? And what is this? And it's not a shark. That's your brain. This is the frontal lobe. This is the temporal lobe. This is the occipital lobe. We'll put the cerebellum in here. Cerebellum. and this is the spinal cord. Everybody with me? What happens with Alzheimer's disease? Okay, and again, guys, I'm not here to give you facts and bore you, but you have to understand what's going on to make sure you understand what potentially may be happening to you or a loved one. Okay, so everybody with me? Everybody, we're going to do this. I do it here before, so you guys will all know what it's all about. But what we're going to do is we're going to look at the G, and while we're looking at the G, bring your right pointer finger in front of your right eye. And as that finger becomes your focus, that takes 350 milliseconds. Does everybody know how fast that is? Can everybody at least imagine how fast that is? So 350 milliseconds is all it takes for you to tell your brain to wiggle your big toe. So everybody tell your brain, wiggle your big toe and wiggle your big toe. 350 milliseconds that took you. How did that happen? How did that occur so fast? That's the uniqueness of the brain, and there's billions of cells up there. And the one we just stimulated with your right big toe is the one at the top of the head. So that's the longest nerve in your body, and that only took 350 milliseconds from you thinking about wiggling your toe and you wiggling it. I give you the timetable because that's all part of Alzheimer's, that things slip because of the damage of the nerves. So we're going to go over what happens, how it happens, how to understand and recognize the changes. And once again, if you're having any of these symptoms, talk to your doctor. Once again, remember what I told you, thinking about, like I might be talking to you about something and I may lose the train of thought because I'm thinking of something else. So it has happened to me where I forget the word. So just because you may or may not do that doesn't mean you have Alzheimer's. But as we're going to talk about, that happens often with an Alzheimer's patient. So again, if you're looking up on the internet and you're reading the things, make sure you understand it. Because you'd be surprised how I'll have patients come in and say, Doc, this is happening, this is happening, this is happening. Do I have Alzheimer's disease? And again, it's good to get information from somewhere, but make sure you check your resources as you maneuver through the process. All right, so back to the brain. So what happens? We're going to draw a general nerve in the brain, and it's called an axon. And it gets connected to other cells, and there's a few billion up there. And what occurs, there's a chemical reaction that makes it happen so fast, and it travels through the nerve. Unfortunately, with Alzheimer's disease, there's an abnormal protein that we still haven't figured out why, but this abnormal protein puts neurofibular tangles. I had to say that slow because I can't say it. Okay, but it's neuro, meaning from the nerve. Fibular is the fibrils of the nerve. Tangles. What does that mean? It's supposed to be smooth and sending that signal 350 milliseconds fast. And what occurs? Because of, we don't know why yet, but there's an abnormality in your body that mutates and ends up producing a protein that plaque forms on the nerve, and the nerve quit working. What happens? It dies. Does everybody understand the concept now? So an abnormal protein that is growing on the nerve causes it to die. Is that bad? Sure, it's bad. What does that mean? How do you characterize Alzheimer's disease? What does that mean? It's irreversible. We have no way to treat it. We have no way to bring it back. We have no way, as of today, to give you more memory. Does everybody understand the concept? Why do I do that so throw it in your face? Because you got to understand this. No one understands this anymore. Everybody thinks they do, and everybody looks it up on the internet, and they think, oh, grandma has such and so, so-and-so. Or she's senile, or she's dead, and Alzheimer's normal. No, it's not. You have to understand this, okay? So again, what happens? The brain's function, we call it neurocognitive. What does that mean? Neuro's the brain. What's cognitive? Your ability to think. So there's neurocognitive deficits. What's the deficit? You just lost nerves. Those nerves are dead. They're not coming back. It's not having a stroke, but it's like having a stroke. If the blood doesn't get to your brain and cells die, you don't move a part of your body. This is the internal part of your body. And as we'll go through it, that's why it's life-threatening. Does everybody follow what I'm telling you? Okay, so the nerve dies because of that protein. With the nerves dying, that 350 milliseconds doesn't occur anymore. Why? Because there's fibrils gumming up the system. How do you want to think about it? 279, or 79 is closer. Think of 79. Bottom here where they're doing all the construction. 4-lane highway, 2 sides, 8 lanes running down. Lanes to get on, lanes to get off. That's how the nerves work. And they happen rapidly because it's a fluid medium. And what occurs? Just like you see now, construction boarded up. I went to pick up my daughter a couple weeks ago at the airport, and no one told me that. Okay? But the bottom line is it stops the flow of data, information. And then once it stops and dies, you can no longer take that route. Well, what did I learn? Well, I went down and did a U-turn, which I wasn't supposed to do, but it was 1 o'clock in the morning. But otherwise, I would have found another way to get on. That's what your brain does. But what happens? It doesn't go 350 milliseconds anymore. And remember how fast that was? We all just did it, right? So you lose the speed of communication in the brain. So there's a neurocognitive deficit because the nerve cell died, and it slows down the speed at which your brain works. Have we figured out how to change that yet? No. Are we close? Maybe. Does everybody follow me? And unfortunately, I have to call it what it is. We don't have a reversibility of it at the moment. All right, everybody understands. So now, what do we see that I worry about in terms of life-threatening? Imagine that brain, and so you can, I'll draw it again, and the spinal cord. And it corresponds, correct? Correct. Front, parietal, occipital, temporal. We'll put in here the thalamus, because that's the train station that controls everything, and the cerebellum. Okay? And now follow me, guys, because remember what I've always told you. If medicine was difficult, I wouldn't be a doctor. It's common sense. You match this stuff up and you see. It's the part of the brain, the speed is changed, so all the things that the brain did through the whole body, everything slows down. So what does that mean? Your heart rate can slow down, your breathing can slow down. How do we know? We don't know for sure, we monitor. What do we find out? It depends upon what cells died and where. Where do the neurofibrillar tangles go? Oh, I said that pretty good. Where do they go? Answer, we don't know. We know where majority settle, and that's why different diseases of Alzheimer's are discussed. They have what they call frontal syndrome, where a lot of it's in the frontal part of the brain, and so patients react differently. But does everybody understand the concept? We match it up. How do we know this happens? Remember the 7 phases we talked about. How do we know in phase 1? Answer, we don't. What does that mean? Just like I said, we don't. If you come into my office in phase 1 and I ask you to do a mini mental exam, who's the president, what year is it, what's your birthday, remember 3 things, all those things that go to the mini mental exam, you're going to score 30 out of 30. Okay? If I ask you to count backwards from 100 by 7s, you can do it. If I ask you the most common 5 cars that you can name me, you can do it. But you're still in phase 1. What does that mean? There's tangles in your brain and we don't know about it. So what does that mean? How do we find them? Anybody ever heard of a PET scan? Positron emission tomography. How do you get them? You have to know the Pope or something nowadays. They're very difficult. But there are machines out there that you can get the test, and it'll identify function in the brain slowing down. Does everybody follow me? Okay, so phase 1, we don't know because you can fool me. And guess what? You do. You know you have it in phase 1. You know the changes that are occurring. You know it. And I don't get frustrated at, I have to call it what it is, right? Let's say fibbed. I don't get frustrated being fibbed to. I have 6 kids. It happens every day. But the bottom line is, it doesn't hurt me. It hurts you. The sooner you know you have a problem, the sooner you need to get into what we call a pathway. What does that mean? If anybody has diabetes, they know what they have to do. You know, they have to watch their A1C. They have to get their urine checked twice a year. They have to get their eyes checked. They have to do all the different things to keep themselves well. Well, that's what you have to do with Alzheimer's. But guess what? No one's going to tell you. Why? It's only number 6. And I hate to say it that way, guys, but I'm independent. I'm allowed to. Okay? What does that mean? The top dollars are up here. 500,000 people died. That was 2010 and 2014 data. It might be up to 1 million now. But it's down here. So what happens? That's where hospice comes in and these other services, because you have to fulfill the needs of the patients as they change. Okay, but understand, this is what it is. This is how it works. This is what we know about it, which is a lot. But again, it comes down to, like any disease, the sooner you know and treat, the better you do, no matter what it is. Does everybody follow me? All right. So let's get to what's important in the life-threatening part. Let me keep this slide up so we understand. Does anybody know what the autonomic nervous system is? Autonomic stands for automatic from where I am, okay? Your spinal cord, from the top of your head all the way down, we have 32 vertebrae. I get to tell you a story. I have 6 children, like I say. My daughter graduated from vet school 2 weeks ago, so we were all up in New York because that's where she graduated from. And my boys were telling me how short I am, right? And, Dad, man, you're getting short. What's going on? So I tried to explain to them how in between every vertebrae is a disc, okay? And what happens is it needs to be well hydrated. I even complain about not drinking enough water, and even mine aren't well hydrated. So imagine 32 of these shrinking, because that's what happened. It's called the nucleus pulposus. It's in between every vertebrae. So if you don't drink enough water and you don't stretch those ligaments, 32 of them shrink. So what do you end up with? I was 5'10" and a half, and all of a sudden I got up on the scale and I was 5'9". And I said, all right, so see, you lose that. That's what's going to happen to you by the time you get to that age. You know what they all said? No, Dad, we exercise and drink water unlike you. And I said, yeah, I did that at 22, but ultimately you got to keep it up. Why do I bring that up? Because when you know there's a problem, one of the best things you can do, exercise. Why? More blood to the brain. What you have to do, everything has slowed down and cells have died. What helps it the most? Your own body. How does your own body's healing mechanism get there? Through the blood. How does it get there if you're sitting in a chair all day? Okay? It doesn't. I mean, your heart will pump, 60, 70 times a beat, but you're not stressing any of the blood vessels and you're not improving your circulation and therefore getting the blood to the brain. So when it's early, and who knows it? You. And who do you tell? Nobody. So what am I asking you? When you know there's a problem, exercise. And remember we did exercise? I told you guys about the challenge I had with doing the Sit and Be Fit. Did I tell you about that? Where I was challenged by the person that ran it because I made a comment to one of my patients that's nothing. And here I went, and the 94-year-old beside me was doing her exercises faster than I could, so as I tried to keep up, I was sweating in 10 minutes. So exercise does not have to be running, it does not have to be jogging, it does not even have to be walking. This is exercise. Okay, so do what you need to do, which is improve the blood flow. The other 3 big things that we're finding work, all on blood flow. Aromatherapy. If anybody hasn't tried it, I did. It works. What does that mean? More blood goes to your brain. It's the olfactory nerve. What do? Household stuff. Vinegar, coffee, What else smells? Pick something. Vinegar, I already said. What else? You guys know better than I do. Vanilla, cinnamon. Just get some of those and just breathe it in through your nose. More blood to the brain. Does everybody understand the concept? One of the things they're doing now, and I hope to start it up here, you take either sand or rice. Rice is easy to clean up when you spill it, so I recommend rice. And you get a big bowl or a pot, and you take an object. Say we're using the microphone. So you look at the microphone, you feel the microphone, and then you put it in the rice. And then with your left hand and your right hand, not simultaneously at different times, you feel it and try to recall what you saw. What does it do? Puts more blood to the brain. Does everybody follow what I'm talking about? The other thing is music therapy. It works. They recommend orchestras so that you can hear multiple instruments. And they tell you to try to pick out the instrument. So you listen 10 minutes, 15 minutes, once a day, and as you're listening to it, what do they call it, classical? So there's a classical musical station. As you're listening to it, it's temporal lobe, more blood to the brain. Does everybody follow what I'm telling you? So you pick it up before anybody else picks up that there's changes in your mind, that you know it's slower than it used to be. Exercise and do the three things I told you, and as we learn more, we'll pass them along. Because that's the whole purpose. You get more blood up there because it's too slow. All right, so everybody follows me? The autonomic nervous system has many functions. It controls the mind, and it controls the muscles. So swallowing, heart rate, the lungs are in there, breathing, urination, defecation, ambulation, and don't forget the cerebellum, balance. Now, will every Alzheimer's patient have all those? No. Generally, it's not till the 7th phase that you see all those get connected, if you will. Generally, like I said, in the first phase, which is you don't even know you have it, meaning the doctor doesn't know the patient has it. The patient does know, they recognize it. In the second phase, what occurs is family and physicians will see a difference. How is that? The family is close to the patient in general to pick things up, and the physician is close to the patient medically. And how do we pick it up? We pick it up by following, meaning what occurs. Remember what we said, it slows down. So if I was able to have a conversation with somebody at the speed that I'm speaking with you right now, and I'm able to ask them things that I know are common things that are hobbies for them, and as I'm asking them this speed, because that's normally how we speak, and their response to me is slow and deliberate, that's a change. So everybody follow what I'm talking about. And family picks up on that. I've had it where, like a vacation, I'll get a call. Doc, I was out with mom, geez, compared to last summer, she's not doing A, B, and C, and she doesn't cook anymore, she doesn't do this, she doesn't do that. So everybody follow concept-wise. So what occurs in phase 2, you're having changes, but it all might be in a concentrated area. One of the things we see pretty common is change in personality. And generally, that comes from hiding what you know you have. Does everybody follow the concept? So there's a problem, and as you're trying to hide it, you're not the person that walks in the room and takes over the room. Or you're not the person that used to, read the stock market and watch Johnny Carson every night. And I know that hasn't been on for 20 years. I'm just using it as an example, But the point comes back to what we see and what you notice. Again, there are changes. What do you do? Seek help. It's the most important thing. Again, guys, that's the primary focus of today. Because again, I do the Alzheimer's with the hospice. I see a lot of patients. And unfortunately, when they come into hospice, it's at the end. And when you talk to family members, It's remarkable, especially the spouse. You know, like, well, he didn't want me to say anything. Or he wouldn't let me tell his brother. He didn't want anybody to know. And that's the piece that if we don't do anything else today, please pass along to your loved ones that you love them, you care. And you have to be aware of the changes. Remember, my youngest was 29 with 4 children. I mean, it's just remarkable. And how does it happen? You know, they'll get to it, they'll figure it out scientifically, but it's an abnormal protein that grows on the nerve and creates that tangle, and it slows everything down. So again, let's go back to understand this connection. This is very important. Now, why would I ask the question and answer it at the beginning, is it life-threatening? I don't know about you, but I was fortunate enough to have a grandfather that was a big part of my life and a father that was a big part of my life. And the toughest thing I had to do with both of them is take their keys. I mean, it's remarkable how, like, that bond of family, love, whatever it happens to be, you can't break it. Even though I know better, I'm a physician. You know, it's like, nah, Dad, you shouldn't be driving. BS. I can drive better than those 16-year-olds out there. So what do? It's called confabulation. They make up a story. And guess what? You buy it, and you don't think that they're demented. You think like they're just trying to save the driving experience. So then what I used to do is send them to the Department of Transportation. Guess what? They can still pass the test. So my father was right. If 16-year-olds can pass it, you know, 80-year-olds with dementia can pass it. But you also have to be aware of the devastation of an accident. And that's what I'm here to promote, that's your loved one, that's your family, that's a special person to you. You are not doing them a favor. I still have vivid in my mind a patient that didn't listen, and he hit the pole on the corner of McKnight and Peebles coming across the road. You know, and he was drinking. And we'll get into that. But my point comes back to, again, you know when you have a problem. And what am I telling you? The 350 milliseconds doesn't work anymore. So guess what? It slows down. What does that mean? Your response time slows down. What does that mean? Get off the road. You know, what have we had happen? People that have to go to dialysis or people that have medical problems and they're still in a certain community, they schedule them at 4 o'clock in the morning and they make them take somebody with them. You know, so there are exceptions to if the person can actually pass the test, and I do have patients that can, that some of these people still can remain behind the wheel, but only at certain times of the day, and it's monitored. And that's what you have to do. And the reason, again, I bring it up is because what happens is the life-threatening part of an accident, we'll put motor vehicle accident, is the person that gets hit has no idea. But you know the whole story. Why do I bring that up? I've had the unfortunate experience of legal liability suits that have come on patients of mine. And like I said, guys, you have no defense. There's no defense. You have none. So please, again, please hear me what I'm telling you, because these are the things that I see. You know, this is stuff you don't see in a textbook. But this is the stuff I've seen, I've witnessed it, I've watched families be devastated. And again, why? Because you love the person. And they can tell you a good story. That confabulation is wonderful. When my father was telling me about it, he was a better driver than 16-year-olds, I believed him. But we did get his keys. You know, so it's, again, one of those things that please pay attention. I don't want to call them rules, but at least guidelines. That's a good way to look at it. They're guidelines. It's like you have a coloring book and it draws the picture. Are you inside the lines or outside the lines? And in this situation, you want to stay inside the lines, play by the guidelines, and ultimately seek help as fast as you can. All right, so let's get into more specifically of the life-threatening and why I listed it as a problem, okay? Your immune system with Alzheimer's disease is deficient. Why? Because of the changes that occur with your body. And when do they occur? You know, one, again, we need the PET scan. 2 and 3, we kind of lump together. Family sees 2 first. 3, I would say the ones with 3 are the patient actually fesses up in phase 3 because they're now at a point where they're recognizing, and it's usually, again, guys, the speed. Even slow people, even people, like I used to always tell the story about my mother. My mother would tell a story. Instead of, you know, on Thursday, June, whatever today is, 16th, you know, at Masonic Village, it would be on a sunny June day on Thursday at 1 o'clock with the breeze blowing, and in your mind you would be like, get to the point. So even slow people slow down further. They may still have the information they're going to present to you, but you'll see it's a difference. They lose planning skills. What does that mean? What I just said, plan. I knew I had to be here at 1, and I'll blame Joanne for being late because she's not here. But my point comes down to I knew my schedule last night, and so I planned to be able to get through my schedule. We all have a schedule. You know, what time you're getting up, what time you're eating, what time you're going to bed, you know, what all those things, that's called planning. It changes. How does it change? It could be real simple. If you don't plan much at all and people call you for everything, you won't remember. They'll call you. They'll say, Joe, picking you up at 4 o'clock. We're going to Walmart. And they show up at 3:45, and Joe's still sitting watching television and hasn't even got ready for the day. Joe, didn't you remember? You didn't call. And then the arguments start. And again, you can't argue with them because remember what I said? They lost that part of the brain. What did they lose? The speed. So they can't take in the information and put it where it needs to go and then respond to it. Remember the 350 milliseconds, okay? So you can put it in and put it out before a second occurs as we're sitting here today. When that slows down, those are the things you see. When does the person with the Alzheimer's see it? Long before you notice it. But it occurs. What else happens in this phase? You fail to recognize, and they say new people or places. So what does that mean? So that's, say, Christmas time, you met some people at a Christmas party. We'll use here because you guys have parties. So you meet somebody at a Christmas party, they're new here, and they come in and talk to you, and you guys know about each other where maybe your kids went to school or something. But you had their name, you said goodbye to them by their name, and now you can't remember them at all. Now, if that happens to you, do you have Alzheimer's? No. I see so many people, I'll forget names. Does that mean I have Alzheimer's? No. It's that millisecond time that's up there. You know, that's what happens like places that have bridges here in Pittsburgh. You know, what you can have is things will lock up because the lights don't allow the cars to come in at the same rate so that they can't get out and in at the same time, and you have what's called gridlock. That can happen to a normal brain. That can happen to a 10-year-old. So it's not the symptom I'm giving you that means you have Alzheimer's. It's what I'm sharing with you that the patient knows when they know it and they don't do anything about it. And even the significant other or family or the doctors will pick it up. Is that the time to confront the patient? No. When's the time to confront the patient? Here, if you can catch on and they tell you, and hopefully they will. If not, as soon as you get into the family and the doc know something, what do you need? A brain scan with potentially a PET scan. And ultimately, I like structure if we need it. What does that mean? That means that I will advise a patient to go to one of the centers. Mercy has a great neurocognitive center. So I might have a patient go to Mercy in order to have that testing done. If I feel that I understand the person well enough, I may send them to the person that the people at Mercy would use, which is a psychologist. And the psychologist will have, you're there at least an hour, you may answer 1,000 questions. Why? Baseline. What does that mean? They know the whole part of your brain by the time you leave. What does that mean? They get into your frontal lobe. What's that? Childhood. They get into your temporal lobe. That's things that you develop. They get into the parietal lobe. What sports did you play? Things that you did. And they get to know you, and as they ask you all these different questions, they get benchmarks for where your mind is. So when should we do that? When there's any question at all, you should do it. And talk to your doctor. Even doctors that owned know that the sooner you get to this, you save everybody money, because that's today's day and age, it's all money. What I'm telling you for is to make sure you see it early and jump on it right away. So what do we end up with? We end up with, we're in a situation, the patient now has said there's a problem. How do we diagnose it? And how do we treat it? Part of the diagnosis is what I said, psychologist or a team, and I'll use Mercy, and I belong to all the healthcare systems, so I'm not biased, okay? I send a lot of people to their program. They're good, just like I send people to the Alzheimer's unit because Teresa's there. And she's been there for, like I said, it's well over 26, 25 years. So you want the person taking care of your loved one that's been at the job they've been at for as long as possible and doing that job in such a way she knows everybody in there. She knows when they went to bed, when they got up, and there's quite a few people in there. Does everybody follow me? So again, where we are with this is when we have the patient admit to the problem and we make the diagnosis, or if in phase 2 or in phase 1, 1 is a PET scan no matter what. Phase 2, MRI, and that determines whether we get the PET scan. Does everybody follow me? Phase 3, you determine, do you want the psychologist alone or do you want the team? And again, guys, that's all based on, I call it support system. If I have a patient that never got married, never had any children, doesn't really have anybody looking after him other than maybe his pastor or somebody, that person I want to go to the team approach because that team will help support that person. If I send someone to the psychologist, that means that they already have a support team in place, but we want to get to the bottom of what's going on, and again, we need that baseline because they will figure out how your brain is working from top to bottom, and they will recognize if there's any deficits at all so that the next time they check you, they can see if there's been a change. And they add up all factors of your intelligence. Like we talk about an IQ score, they would get your IQ based on the information that they're asking, not to know your IQ, but just to get the baseline of what they identified. So it's those kinds of questions as well as your memory, as well as your hobbies and what you enjoy and things like that, and then how you talk about it. Remember we talked about the speed at which everything works. So that's why we connect you with one of these when there's been a problem that's identified. Now, what's the treatment when they're at that, I'll put beginning phase because it still is beginning. There's Aricept, there's Namenda. Just the one I just pushed? Yes. I'll put here other prescriptions, okay? Have they been proven to be beneficial? They've been proven to help prolong the phase that you're in. And the way we describe it is a long run with a low descent. Steps. Think of steps. You know, you have certain steps that, Yeah, you have to take that giant step to get up, and then other steps could be this high. That's how we characterize it. That the medicines that are out there can help prolong where you are before the change. Is that proven for everybody? No. Do I recommend it for everybody? No. How do we make that determination? Talking it through with the patient, because all the medicines have potential side effects as well. So once again, what are we talking about that we know works? Blood to the brain, exercise, the things I was telling you about to use the brain. So what should you do on your own? Word search, crossword puzzles, things with your mind. Read. Does that mean read a book? No, read the junk mail. When your mail comes in and you pitch the junk mail, read it. Why? You're using your brain. What does that do? Brings more blood to the brain. That's the whole purpose. Do exercises. That's what helps the most. In all the data, that's what helps the most. Again, do I say no Aricept, no Namenda? No, I'm not saying that at all. I'm saying go with what you know works. Talk over with your healthcare provider what may or may not benefit you. Talk about the benefit it would have for you. Is it worth the risk and benefit if there are side effects to it? And take it if the team decides. And if you're doing it with the psychologist and your own PCP, that's the team. And of course, the family. Does everybody follow me? Okay. Now we get into, I lump together 4 and 5, because now we move from mild and we're pushing into moderate disease. What does that mean? Okay. I remember that by dress. What does that mean? You can't dress yourself anymore. What does that mean? Can you put on a pair of pants? Can you put, yes. But you don't have, remember we talked about planning. You don't have the ability to recall, that you may want to do your bodily shower or whatever you do, and then put on your socks or whatever you do. That planning stage has changed, and now when you hit this phase, because of all the changes that have occurred in your brain, out of your control, we haven't figured out how to stop it yet. You're repeating things, you're driving your caregiver dizzy because of they don't understand. And so what occurs is you try to get the patient at that point to get involved with something that they enjoy. And that's where sometimes the music comes in, which is sometimes so soothing for everybody. Okay, but again, back to that point, we're now beyond the mild, we've got into moderate, so we put dressing, and we talked then about ADLs. What are ADLs? Activities of daily living. Can you still groom? Yes. Can you still bathe? Yes. Can you still move your bowels and bladder? Yes. Okay. So what has happened? Remember we showed the brain? Let's put it back. When we showed the brain being there side by side with your body, this is when you start to lose those functions. If I don't have it on that one, I quit. I'll put another one. I'll put another. Oh, look at that. Okay, so again, now we're starting. It's making its way because the lack of the speed to connect the neurons together for your functional day-to-day routines have started to decline. And we notice that in different ways. Like I said, with the hospice, they have what's called PPS and KPS, and these are statistically analytical ways based upon the data you put in. What is that data? Can the patient comb their hair, brush their teeth? Can the patient toilet themselves? Can the patient feed themselves? Can the patient get up from the chair? Does everybody follow me? And again, we're in that moderate range, 4 to 5, and we're seeing the change. Why is that happening? Because the connection, remember, we wiggled our right big toe, the longest nerve in the body, in 350 milliseconds. That's not happening anymore. They can't even understand me telling them to wiggle their big toe. Does everybody follow the concept? Okay, so we're now at a phase where things are starting to change with the patient, and these changes that we're seeing are now taking up more of the patient's bodily functions, okay? When we get into 5, this is where you can get a change in the bowel habits with control of the sphincter. And why is that? Remember the body and all the nerves. Okay, the autonomic nervous system controls the bowel and the bladder. And what has happened? It has slowed down. Remember that, guys. That's what it's all. When cells die, what they were connected to is disconnected. There's a billion cells up there, more than a billion, so they can reconnect, but it's never the same as it was in terms of the speed. And then as more of the cells die off, and they're all called connections. You know, we used to have to learn all those spinal cord connections, they used to call them. So how does it get from the top to your wiggle your big toe? You know, the spinothalamic tract it's called. And then from the thalamus, there's another pathway. And all that happens in less than a second. All that is gone. And when the timing changes, that's when we see these different changes, okay? What happens at this point, it's up to what are the bowel habits. So 5 to 6, we're moving from moderate now to moderate severe. So they bunch them together. So what does that mean? Now the patient does not have control of the bowel. And when they're eating, sometimes they need what's called cueing. What does that mean? That means they still can eat, there's not a problem, but all the connections aren't happening as fast as they used to, so they're not going to go sit down and eat because they're hungry, because they don't have that same sensation of hunger that you and I do. And so what occurs is they need cued. What does that mean? Come on, Joe, we're going to go eat. You know, and you sit down with Joe, and you put the food on his plate, and you start eating, and he follows what you're doing. And then what we'll see, because when we get into 6, before you get into 7, you'll see changes so that the eating goes from a regular diet to pureed or mechanical chopped. Why? Remember we talked about the speed. The speed at which we chew, we eat, the things that we do, they can change. And they do change. And so as that changing occurs, what do we need to now pay attention to? Remember we hit the moderate to severe. This is when we need to have help, not just a caregiver. This is when you need a professional. Is it every day, every moment? No. That can all be figured out based upon what the needs are. But this is when you have to watch. And remember we talked about life-threatening? I have a lot of patients that will say, Doc, I'm working. You know, I'm just going to lock Mom in the room. You know, make sure she can't hurt anybody or hurt anything. And I have to put my fingers in my ears and say, I didn't hear you say that. You can't. You'll never forgive yourself. If Mom falls down the steps or she trips and she hits something and something occurs, you'll never forgive yourself. No, you can't do that. Are there people out there? There's organizations that will help. And so what you do is you get people to make sure. What are we talking about? How many times are you supposed to chew your food? All right. So do you think a person with Alzheimer's remembers that? No. So what do? I think I told you the story. My son won $50 because he ate a Big Mac in 2 bites. All right? So what happens? The person that doesn't know better, and again, twice a child, once a man, I'm watching it. So what occurs is this person loses that swallowing function. The muscles change, things change. So that's when we change the texture. You know, we don't give it to them because we don't like them. We give it to them to protect them from what? Aspiration. That's one of the main causes of death in an Alzheimer's patient. What happens? They're chewing their food. They're chewing their food. I've had nurses tell me, Dr. Coppola, it took 2 hours for Joe to finish his lunch. Did he eat it? Yep. Then that's okay. Spend 2 hours with Joe while he eats his lunch. But the point comes down to if you don't spend that time with them, they're going to rush. It's going to go down the wrong tube. And when you aspirate with a low immune system, your body weight declines because you're not eating the way you used to. All the changes of the speed, that's the same thing that happens internally. Everything changes, so what occurs? That aspiration pneumonia could be the cause of death. Does everybody understand the concept? And we're back to the life-threatening part, guys. That's why I brought it up this way and I started with it, okay? The last thing that I'll tell you about 7, this is when recognition changes. And it's funny, I still have patients that will remember me. And I love that because that means I connected to some cell up there that's still working. They won't remember their family, but they'll remember me. And of course, they see me a lot less than they see their family. But I guess I have a lasting impression upon them. But the point comes back to that's a hard thing to take as the caregiver. Mom, come on, I'm your daughter. You remember me? Shirley. And it's so hard because the caregiver doesn't understand. And one other one, I'll let you go. Sorry to hold you up so late. Behavior. Please be kind to people that have dementia. That like hits me so hard because of what I've seen. I don't want to say everywhere because it was never here, but let's just say all too often. These are human beings. And when those brain changes occur, they don't know any better. So if unfortunately, you guys call it the hill. So if unfortunately you're up on the hill and at 2 o'clock in the morning, someone screams and it's my patient, don't get mad at me. It's okay they scream. That means they're still with us. And again, guys, remember what we talked about. All those interconnections that enable our personalities to be what they are and how they are when that changes. All of a sudden, Joe, who was the calmest, nicest guy in the world, never hurt anybody, he's going in everybody's room and fighting with them. I hear that a lot. When I talk to my nurses, they'll give a report. And they'll say, oh, yeah, Nick was in 4 different rooms this week. Well, why is he going in those rooms? Well, I think he's looking for snacks. Well, give him double portions at dinner. And then 3 months later, when we report on Joe again, he's not going into other rooms. And that's the problem. There's staff there, but they don't understand that the patient, and that's the other part, the patient looks wonderful. You can have stage 7 of the Alzheimer's disease. Weight is definitely down, so they'll see changes to the family. But the people that don't know them, they don't look unwell. They don't look they're about to leave the world. That's why I say the life-threatening part comes from how things slow down and the dangers we put ourselves in. So please, 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 please remember early. And I promise you, the way to the best success is the early recognition and blood flow. Please remember that, okay? If we did that, then we got through today. Good, I'll answer any questions you guys have. Ooh, no questions. I must have put you to sleep. Yes, sir.
You've described enough things that I have a wife that's sturgeon. And how do I get an appointment with you?
That's pretty tough nowadays. I don't have my help I used to. All you have to do is see Dana. Actually, tell Sherry. Tell Sherry. Sherry. That'll do the trick. And I was told, like I said, my daughter graduated from veterinary school, and so the whole family was there. And what I was told more than once is I was illiterate. Excuse the frog in my throat. I said, what are you guys talking about? That's my speed, and I choose it because I don't mind Big Brother can watch me anytime he wants, but what I know to be true of the other phones don't happen. They still happen, don't get me wrong, but as we tried to argue about it, they still came back and told me since I wasn't computerized in the office that I wasn't being fair to my patients. And what I'm understanding now is because of the technology that's out there, the patients get the information faster than we do. So for those of you guys that may or may not know, I am definitely going to be computerized before next year, and we're in the process. So if you see me here with a flip-top computer and typing in instead of looking at you, it wasn't my fault. They made me cave, because I really do see if it's going to benefit the patient, and now that I recognize we have to do what's called a face-to-face. It used to be if a patient fell and broke their leg and I thought it was a leg break, I would just write x-ray and the patient would go. Now we have to get it approved depending upon what the insurance company is. And what I find is if you're computerized, all the information about the patient is in there. So it's boom, and it goes. And all they ever say to me is, Dr. Copp, we can't read your notes. You have to write a different note and send it out because it's a face-to-face. That's the only way they're going to get the service. And so that's what I'm doing. I'm literally rewriting notes so that the person on the other end can read the note in order to allow the patient to have the service or not. And again, it's frustrating to me because I'm used to, like, you write the order, you get it done, and you move on. It's not that way anymore. But as I always say, it's still the best healthcare around. You know, even if there's a delay, even if you have to be observed instead of getting admitted, it's still the best healthcare you'll ever find. And by the way, Pittsburgh had the first PET scan at St. Francis Hospital where I worked, and my friend Dr. Wapinski was part of the team that invented it at UCLA. And it's remarkable what it can do. And I'm frustrated because if you live in Japan, the ambulances have hyperbaric oxygen, and every emergency room has a PET scan. So you get the hyperbaric oxygen immediately, and as you come out of the ambulance, you go right to a PET scan before you go back and get checked. Question? Sure. Sure. Yeah, what happened? Go ahead. Mm-hmm. Great question. I also thought hospice was end of life, and I also thought palliative care was just preparing them for hospice. And then my parents got older, and I watched how there's 3 doctors in my family, and my parents did not pass away the way they wanted to pass away. And what we found was hospice was organized. And they've done this so many times. They don't allow 6 children to argue. You follow me? Like if you allow 2 people to make a decision, unless you spell out exactly what you want, you can get 2 different choices. And what hospice does is they have a great plan in play because they've done it so many times. And when you hit that stage 5, all you do is contact them and they come out and do what's called an assessment. All the things we just talked about, they know how to inquire and examine to document. That gets them admitted. And I'm happy to say, geez, how many years have I done it? I've done a lot of years, more than 10, longer than Homeo's been around. We have a lot of people that get discharged from hospice. You know, it's not like you have to die. You know, a lot of times it's just to get things organized, and then when we as the team see, well, they're eating, they're drinking, they're moving their bowels now, you know, they're doing things better than they were, we kick them out because they're not on their way out. They've stabilized. And that can happen, especially with the COVID. We had a lot of people get COVID pneumonia, have a big decline, come on hospice service for 9, 10, 12 months, and then they get discharged because they're not qualified. So just the fact that you're thinking about it, you know, what you probably want to do is talk to friends or family, your doctor or whatever, and get someone out to do an evaluation. And then that team will talk to you immediately. And they have all services. They have a chaplain, they have a activities director, they have a music therapy, they have social workers, they have so many people connected, and that's all hospices. It's not just any one. All hospices have to have that team. And based on the needs, they come out as often as they need. You know, whatever the needs happen to be. Is it every day? If the person's in that much of a decline, yes. And it's all run by Medicare, so there's guidelines. Good. Other questions? Yes?
You're about my age.
Okay. 32? Nice. Go ahead.
In my lifetime, I've noticed a huge uptick in Alzheimer's patients. And, you know, that's from a layman's point of view. Is it the same in a professional's point of view?
Good question. And again, this isn't out of textbooks. And it actually comes from my 2 daughters that wanted to get into health coaching, and I pushed them into what's called integrated medicine. So they did an 18-month college course to get integrated medicine certified for their health coaching. And I want to say, I'm not allowed to promote it. I can't say the name of the bike, but there's bikes out there that have a video screen. My daughter's on that video screen. She does the workouts, you know, so they managed to get this certification and climb the ladder. And what I will tell you from what they're seeing, it's all what you eat. And the genetically modified foods, listen to what I'm saying. Genetically modified foods. Does everybody follow me? That means they're playing with the gene to change the function of whatever it happens to be. And what my daughters made me and my family do, or at least think about, the book is called Wheat Belly. It's unbelievable. You know, what's it called? Roundup? Our wheat today can survive if you spray Roundup on it. Does everybody follow me? It will kill grass. It'll kill trees. It won't kill wheat. Is everybody with me? I have a son that lost 32 pounds just stopping wheat, period. That was it. So I think the connection seems to be gene modification. Why? Whatever we find out, it's going to be called a mutation. What's a mutation? A change in the normal cellular function. So again, it is on the rise. I told you we had a 29-year-old.
Environmental aspects are contributing.
I don't think there's any doubt. And some of the things that have been investigated are still under investigation. You know, I believe the good old days, what were they called? Cast iron skillets? You know, there's nothing wrong with those, right? Now they got every kind. You can't, my wife gave me a skillet at Christmas, actually, because I always destroy everything. She said, you can't hurt this one. Yeah, you can if you leave the stove on and there's nothing in it. Yeah. Sure, that's a theory. All that's a theory. Has it been proven? Not yet. Why? Could it be the lobbyists not allowing it? Who knows? But there's a change. Yes? Good question. What's the difference between dementia and Alzheimer's? Dementia is a neurocognitive change in the brain that leads to the person that it's affecting, their inability to perform their ADLs, activities of daily living. That's dementia. It comes in many flavors. One is called senile dementia. That's what we used to say grandma had. And that's a vascular dementia, where the small little blood vessels, because of the elasticity in your body changing, they break, and they're called lacunar infarcts. And that is a common one, but the most common is Alzheimer's. Probably 60 to 70% of dementia, which is that change in the ADLs that occurs with the patient. Alzheimer's is the number one cause. Vascular is probably number two. And then they have different disease processes that contribute. One is called Parkinson's. One is called frontal temporal lobe. One is just from vitamin D or B12. If you have deficiencies, that can lead to dementia. So some dementias are reversible. Alzheimer's is not. Vascular is not.
Can dementia eventually go into Alzheimer's?
Generally, if it's not Alzheimer's to begin with, no.
After my brother died, I thought he had dementia. He died in 2 years.
Gotcha. Again, it could have been what we were talking about, that the dementia changes the speed at which the nerves work. And so the heart, the lungs, the GI tract changes can occur, and that can contribute. Like people would have, not everybody's going to have a heart attack if it doesn't go down that pathway. But there have been patients that were known to be marathon runners and physically fit, and they end up dying of a heart attack because the nerve that was affected slowed the heart rate down. You follow me? So it's variable. But understand, the way I would use it to confuse you more probably, it's like congestive heart failure. Everybody thinks that's a disease. No, that's a finding that the fluid backs up in the heart. That's how dementia is. Dementia isn't in and of itself a single disease. It's a category of the patient can no longer bathe themselves, dress themselves, feed themselves in the capacity that they once could. They're not in reality. They're outside of the norms of, daily routines that you do. They can't do the planning and other things. And under the dementia, 5 or 6 categories. Number 1, most common, Alzheimer's. Number 2 is the vascular. So that's how that works. Okay? Good. Other questions? Yes, sir.
Two-part question.
Shoot.
What's the average age you see somebody start to get Alzheimer's? And is there an upper limit when you get to a certain age you don't have Alzheimer's? You may not get it.
Good question. I think the answer to that is, as you described your Alzheimer's, I would look at how you described it to me as being dementia. Like Alzheimer's is the neurofibular tangles. I've seen 29-year-olds, 45-year-olds, 50-year-olds, quite a few 65-year-olds. So we see Alzheimer's occur and affect people early. Does that mean they can't get it at 85? It doesn't say they can't, but generally, if you hit your 80s and you don't have those neurofibular tangles in your body, I think you've gotten through and you'll probably do okay. Can another dementia get you? Yes. Vascular dementia can get you. Or other dementias that come from other things. We've done that talk, we'll do it again. What you eat or drink has a big part of it. People that smoke or people that drink or people that, have low nutrients such as the B12, the folate, the thyroid. And if you stop drinking, stop doing those things, take your thyroid hormone, eat better, some of that's reversible dementia. Alzheimer's, which is a form of dementia, never goes away. There's nothing we know right now that can make it go away or improve. Did that answer your question? Good. Other questions, guys? Yes, sir.
Average age from the time of diagnosis to fatality, is there?
I don't think there would be a range that anybody's given or a mean that anybody's given. That's part of what we're talking about. Because to me, my mother-in-law, I smile because I've told so many stories about my mother-in-law over the years. But my mother-in-law had dementia. Hers was vascular. And it was amazing. She lived like 20 years, 90-some years old before she passed. So it's variable. But once again, she ate well, she exercised. I mean, the things that once you identify there's a problem, if you take better care of yourself than you were before, gives you the longevity, the best that I've seen. So I think the short answer would be, I don't know, but hopefully the insight I give you shares with you that it's variable. So it's individualized, and again, the exercise and increasing the blood flow is what I've seen helps the most. Good, any other questions? Yes?
I was gonna say, my brother was 89
When he died. So it doesn't necessarily cut your life short. When I talked about the life-threatening, what I'm talking about is we all love the person that has it. Don't let the love get in the way of common sense, because the accidents that can occur when the immune system's down, infections like a urinary tract infection that would normally give us symptoms, you call the doc, you take a pill, you get through it. Someone with Alzheimer's, if their immune system is affected, that could be the cause of death. You follow me? So you see a lot of people live into their 90s because they were healthy when they got the disease, but it doesn't mean that someone that's healthy when they got the disease can't succumb to this life-threatening fatal disease called Alzheimer's. Is everybody with me? Good. Thanks for having me, guys. Sorry that Joanne made me so late.